Hello everyone, welcome to part 2 of our video where we are talking about PTSD or post-traumatic stress disorder. In today's video we are going to talk about the other category of PTSD, which is intrusion symptoms. So if you have not watched our first video about PTSD when we are talking about trauma, please you can find it out and watch it out. So uh, if you are still new to our channel, we request you to subscribe, and my name is Birabi Enock Francis, a psychiatric clinical officer from Uganda who is bringing for you this wonderful information. If you have any symptoms of PTSD, we request you that you may can see a psychologist, you may see a mental health professional who will be able to support you. Okay, so another category of symptoms of PTSD is that under the category of intrusion symptoms. So I think we have heard about intrusion, like something intruding. Like if I say you are an intruder, means that you have entered into maybe my home without my awareness or my permission. Okay, so when people go through what we call traumatic events, for example, you see your relatives being shot dead in the war zone area, or you see maybe someone undergoing what we call rape or defilement, maybe when you are still a child. Okay, this event makes us to be what we call traumatized. Okay, you still have those memories which come and disturb you, so there will be experiencing symptoms of PTSD. So under this category of symptoms, we are talking about intrusion symptoms, like you have been in the war zone area. Maybe let's say take an example of a woman who has been who has undergone defilement or has gone under rape, and maybe you find around maybe five men, they have raped you, they have done rape on her. So this lady's mind is not going to be remain the same. Okay, so you'll find that every time wherever you are, you'll have such kind of experiences. So today we are talking about intrusion, that you'll have what we call recurrent and involuntary thoughts. Like there are thoughts that you don't need to think about how that experience, that bad experience happened to you. Okay, no one would want to think about how it happens to you. So, but you find those intrusions into your mind. You find those thoughts about the traumatic event coming to what? Into your life. So this is under what we are calling intrusion symptoms. Then another symptoms under intrusion is that you'll have what we call recurrent distressing dreams. Like when you go to sleep, you'll have what we call nightmares. I think most of us have dreamt. There's when you dream and people are chasing you, maybe they want to kill you. Then you run and you find yourself falling into what? A deep pit. Okay? So this is more than what we are talking about today. That when you are having PTSD, you may have nightmares which are very scary. So when someone wakes up of the dream, you find your heartbeat is beating a lot. You find the heartbeat is too much. Okay, why? Because you had a nightmare. So you'll have a nightmare which is related to the traumatic event. If it is rape, you find the incidence is related to the rape. Okay, if it is killing of your relative or your wife, you find it is related to that. So you have what we call nightmares. So you'll find those things coming by themselves and you don't want to think about them. Okay, and then there's what we call dissociative reactions, like you'll be having what we call flashbacks. Okay, like you don't want to think about this memory, how this act of rape or defilement or killing of your relative came to be, but you find yourself having flashback. I think most of us have seen, like it's like watching the highlights of a football match. Let's take an example. Your best team. Okay, let's take maybe the best team maybe could be Arsenal, where maybe that match where they hit you very many goals, maybe let's say 8-2. I remember in 2000 around 8, where Man U beat Arsenal 8-2. So when you go back home, okay, you'll find that if you go to sleep, you'll find you have flashbacks. Like that match is happening. You see how they are scoring you those goals. So those, what we are talking about is like people who go through this bad experience or traumatic events or life-threatening experience, is that whenever they find themselves experiencing flashback as if that event is happening there and then. Like watching that highlights of a football match where they beat you seriously. So these are under what we call intrusion symptoms. You don't want to think about it, but they still come. Then also within you also have what we call psychological. You are not fine, you are not settled. Wherever you are, you feel this, but these symptoms keep on coming into your life. So these are under the categories of what we are calling intrusion. So we have said that PTSD, the symptom must have been there for at least more than 1 month, and you must be exposed to what we call life-threatening experience or event. And also we have looked at this category of intrusion. So we are looking out for people who can partner with us so that we can continue spreading these mental health messages to different people. Okay, about 32% of Ugandans have mental illness, but majority of them don't know that they have mental illness. And even these people, they don't have access to a psychiatrist. So we want to reduce this gap. And also research has told us that 70% of mental health patients, they first have to seek to go to religious leaders for support before they even look out for a mental health profession, which is like the last resort. So we want to reduce this gap by going out to communities, teaching people about mental health on the radios, also in Nakivale Refugee Settlement, where I worked with medical teams. So if you are out there, you are an organization, you are an individual, and you are willing to support us, please, our numbers are there on the screen. Please, you can get in touch with me, and you shall be grateful if you join us on the team. So having these symptoms, if you're experiencing those thoughts, those distressing memories are coming into your life, you don't want to think about them, these are symptoms which belong under the category which we say intrusion. Okay? You have nightmares which are related to the trauma. This is under what we are calling what? Intrusion. And the other category is that you are having flashback, like the event is happening now, but something happened some 2 years back, but you are still experiencing it as if it is happening now. So these are symptoms of what we are calling intrusion under PTSD. So thank you so much for watching. In our next video, we are going to look at another second category, which is called avoidance. Okay? There are tendencies of people when they have gone through traumatic event is that they try to avoid things which are related to the trauma. So thank you so much. See you in that video.